It's a really big and diverse program.
Huge range of things that are actually offered that aren't well known.
It's a fabulous program.
It's a great place to work, it's professional.
Because it makes people's experiences of hospital hopefully a better experience and a less stressful experience.
For the rest of my life, it's something I'll never forget.
You know, medicine isn't the only answer, there are other options.
It's a program that has lots of potential, and I think
Arts in Health at Flinders Medical Centre, FMC, is a unique program in South Australia that is integrating arts into the daily life of the hospital and enhancing Flinders Medical Centre's role as a leading health promoting hospital. The program is managed by an active support committee of South Australian arts and health professionals.
So the program is multifaceted, like we have 4 galleries that we operate with regular changing exhibitions, and we have a series of workshops that we run, drawing workshops, musical instrument making workshops. Part of that is to encourage people to come into the hospital when they're not sick, so they have a positive experience of being in the hospital. You know, we're a public institution and we want people to feel that we're not interested just in their illness when they're sick, but also the whole of them.
Different performances on the ward that vary from live music to puppetry, storytelling and dance. And I think it's just a fantastic program, and whenever people engage in it, from the patients and the staff's point of view, they have a great time.
We have a weekly music performance program. We have an art trolley that runs out 1 day a week, and we have a series of public artworks that have been commissioned for the hospital. And on top of our regular program, we also have a program of projects that run throughout the year. So earlier in the year we had puppeteers working in the hospital and a felting project. And at the moment we have a storyteller who's telling stories to patients on the ward. And then we have another project later in the year called the Flags of Hope. So the program is really set up to make the hospital a more warm and welcoming place for people to visit, and also hopefully we can support patients and also the staff in their visit to hospital.
Gardens and gallery spaces, public art and performances provide a break from a busy hospital environment, creating space for relaxation and reflection. They bring joy and create a distraction from clinical care and treatment regimes. Since 1996, Arts and Health at Flinders Medical Centre has been improving the physical and social environment of the hospital to help create a healthier, healing culture for patients, families, visitors, staff and volunteers.
So obviously for the patients, it provides a distraction. Hopefully the music also provides relaxation and a soothing and a healing, which can then also support recovery. So there's lots of evidence around the way that art in a hospital can actually support a patient's recovery, that patients stay in hospital less time, they need less pain relief, immune systems are boosted, levels of stress and depression are alleviated.
I look at it from the staff point of view, from one aspect, and I think it's good for the nursing staff in that it breaks up the day for the nursing staff to see someone from Arts and Health coming around with the music bowls, or just something totally left field that sort of strikes you and just takes you out of your day and thinks, takes you out of the busy environment.
So it provides avenues for expression or for interaction that the routine medical, nursing, allied health care doesn't provide in a hospital.
But what's the most inspiring thing is when you are actually out on the wards and you see the effect firsthand of the work that some of the artists are doing. So you see Heather Frown with her Tibetan singing bowls actually taking people into states of relaxation.
The rewards of this work is feeling a sense of connectedness with your community, with my community, and complete strangers, and feeling by the end of my time with them, that they're a friend, and that's a beautiful reward. And also to obviously see the effects of the work, to see people closing their eyes and feeling the effects of the singing bowls and drifting off to sleep when I might sing them a lullaby at their bed, or
had a wonderful time with a 16-year-old who's been through a huge amount in her life with leukemia, and she's having to face another transplant. And when I'm with her, it's like, oh, cup of tea, or, you know, she's very, very much taking in her stride these experiences, and I think, what an amazing person.
Many of the professional artists within the program face challenges every day. The hospital life is a very unpredictable environment. It is not easy for the artists to perform their own skills to patients who are sick and to staff workers who are always busy. There are many challenges that they have to confront and work around.
when you come to the hospital as a musician or as a worker, you're confronted with death, you're confronted with sick people, their families who are suffering, and the staff who are also quite tired and stressed sometimes. So those are some of the challenges too that make you as a person have to grow and grow spiritually within the work.
I guess I have a very short period of time to engage with the patients, and for me it's important that I share stories with them that have meaning. So, you know, you've got this random person that turns up, oh, I want to share some stories with you. So it's about working in a short period of time to get to know that person and try and sense what's really important for them.
I think the challenging things for the program and also for the artists is the unpredictability of the environment. I mean, we're an acute care hospital with a large emergency department. We're extremely busy, especially in winter.
So when Arts and Health come and they're very sensitive to, which patients would be appropriate for them to engage with their activities. And I guess the challenging part is for me to identify those patients. But I do find that they're quite liberal in their understanding, and they'll actually go and see patients fully knowing that that patient might not be appropriate.
To be sick enough to get into Flinders Medical Centre particularly, you have to be very sick. So the patients that are actually on the wards are very sick, and with that comes the fear of the unknown, fear of diagnosis, fear of interventions, all that sort of thing. And the Arts and Health program is a way of alleviating some of those negative emotions. It's a way of interacting with people just on a normal person-to-person basis that doesn't involve a lot of the medical interaction type things.
The interaction between the patients, the staff workers and the professional artists is very important for the Arts and Health program. Without this interaction, the program would not survive.
The interaction is very one-on-one. Sometimes when you're working on the wards, there's 4 bedded bays, and you might go into a room where there's 4 patients and they're all laying and resting, and you're able to work with all of them. But it's always great too when you can actually work one-on-one with a person and get to speak to them, hear their story, and just sing just for them.
I think the engagement and the interaction with the patients is what it's all about, and that's what I value is with it.
I really treasure the opportunity to share a moment with people where they can step into another world and beyond the world of the hospital, and to live in an imagination.
We had an artist in residence, Rebecca Campbell, who painted 14 metres of artboard in the gallery downstairs over a period of 6 weeks to live music. And there was a young woman, Becky, who had Down syndrome, and she had had a heart attack on the Friday, and she came into hospital, and over the weekend she went into heart failure, and they didn't think that she would live for long. And a few days later she stopped swallowing, and they put a nasogastric tube down and took her to X-ray, and they took her through the corridor in a wheelchair, and she went past Rebecca, who was painting, and Rebecca instinctively handed her a paintbrush. And she took it and started painting, and the parents were absolutely convinced the moment she touched that paintbrush was the moment that she decided to live. And then she just wanted to keep painting with Rebecca, and we've got some wonderful images of her painting. Rebecca painted in a bride's dress in the gallery, and so it was quite a performance installation. The Arts in Health program at Flinders Medical Centre has been running for 14 years now. And it's gone from a position of people being a little bit sceptical about why you have arts in a hospital, to being a position where people accept the program as being part of the hospital services, to now being in a state where we continually get referrals from staff on the wards, from social work and allied health and nursing staff. Is the art trolley around? Is Heather in? We've got someone who'd really benefit. So we've now become really embedded as part of the hospital fabric. We've had a major redevelopment at the hospital, so another aspect of the work has been around the environment, and arts being not just seen as paintings on walls, as being seen as a whole development in the design of a building, that it's the shapes and the colours and the textures around you that influence the way in which you feel. And if you can actually tune those down to the different areas of the hospital as to what experiences people are having, it's another way of supporting people is actually through the physical environment.
The program also supports an Aboriginal health unit within the Flinders Medical Centre called Kapa Narratendi. The unit supports Indigenous Australians who need help in either a physical or mental sense.
We do a lot of work with Kapa Narratendi, the Aboriginal health unit. 5% of the population here at any time are of Indigenous descent, and so we try and do projects that make those people have a distraction from where they are and make them feel more comfortable. They're often in here for long periods of time, the Aboriginal patients, and so we have a whole series of activities where we do projects specifically working with Aboriginal patients.
Every person involved in the Arts and Health program has a memorable story to tell. The stories that are told are inspirational to hear and are life-changing. In particular, Heather Fran has an inspiring story to tell.
When I first started coming here, there was a woman who had cancer in her spine, and she was very sick and had been in hospital for months on end. She had a beautiful family and they were often there visiting her, and one day I went into this room and felt that I needed to play my singing bowls and the gong that I had at the time, a Chinese gong, to her. And it was the first time I'd ever really spent a one-on-one session with somebody doing a sound relaxation session, and it was so profound, the effect that it had on her, that she almost went away to another world. And when I left the room, she didn't really know that I'd left because she was quite relaxed and in her own world. And then a few weeks later, when I came back to see her again, she didn't think I was real. She thought it was all a dream because it was so magical for her, that experience. And when I came back, she was saying, "You're real. Oh my God, I can't believe you're real." And all the nurses were saying to her, "You're going crazy. That woman was never here." And so her family ended up buying her a set of Tibetan singing bowls for her to use herself, and that was fantastic. Unfortunately, she passed away. When she did pass away, her family, I got to speak to them on the phone, and they just told me how grateful that she was for seeing me on those few occasions and how much it actually changed her life, the last weeks of it.
Fundraising, donations, government grants and sponsorship are what enables this vibrant and inspiring program to have a positive effect across the whole hospital.
I just think it's so important that, you know, that hospitals and healthcare, you know, are able to invest in something that really, you know, provides the level of support it does to patients.
What I do understand is that, you know, medicine isn't the only answer. There are other options, and I think, you know, this is a safe other option.
You know, if we had it 24 hours a day, 7 days a week, I think we could possibly see much greater reduction in length of stay because patients are happier and they're more relaxed, so they get better quicker and that sort of thing.
It's a program that has lots of potential, and I think the potential is really just being, there's a start there for what could actually happen, and I think it's fantastic that the medical staff here at Flinders are open to this kind of program growing and benefiting the patients.
The Arts in Health program has the opportunity to bring hope and healing to everyone in the Flinders Medical Centre by integrating arts within the hospital environment. The program has so much potential to deliver success in South Australia, Australia and even around the world.